Hello and welcome, everybody. I'm really glad that you're hanging in here with us today. If you've been with us all day, thank you so much. I hope you've learned a ton and had a great time doing it. This is one of oh this topic title was one of my favorites. Waffles ain't for breakfast anymore, ain't just for breakfast anymore. I loved it. I thought it was going to be a lot of fun, so I'm excited to host this with me today. Karen Ashforth and Phyllis Keith are both on here. And I'm going to give a quick introduction to Karen, but I also want to just mention that I put two links rather in the chat, and in there, the first one is a Microsoft Teams meeting that we have been hosting all day. It is our lounge. That lounge is for people that you want to get in there. You want to meet some of my team. You got some extra questions you want to ask. You can jump in there, ask anything you need to ask, and that'll at least you'll get to, if you've been using us in the past, you'll get to put some faces with some of the people you've been emailing with or chatting with on the phone. So that's kind of fun. And then the other link there is compressioncare.com/big day of training resources. That's where you're going to find all of the cheat sheets and the fun things that Phyllis and Karen have provided for you. And you can download those forms and get all that information. You can also click the Get Certificate button. That Get Certificate button will allow you to take a short quiz. Surprise, you got a quiz, but you'll be able to take the quiz, and then at the end, you will get a certificate of completion for this course. So you can take that certificate of completion, send that into your accrediting body, and usually they will approve some kind of CEU for you or CE for you. Uh, but those links will be there. If something goes wrong with the links, or you can't access the links, or you lose them in the chat because so many people ask questions, don't stress it. It's not a big deal. We will be sending out follow-up emails to say thanks for being here, and you will have all of these resources for you. So I'm going to introduce Karen right now because she's going to be doing this presentation today. And she's got a lot of things behind her name here: MS, OTR, the L, CLT, Lana certified. And she has practiced as an occupational therapist for over 40 years and has specialized full time in lymphedema and lymphedema treatment for over 20 years. Karen is considered an international expert in treating complex lymphedema and lymphedema cases, addressing underlying fibrosis and inflammation. She has pioneered and participated in the development of numerous innovative compression garment and pneumatic compression appliances. Karen speaks frequently in academic, clinical, and professional settings and performs clinical research, which she publishes and presents nationally and internationally. Karen currently practices at St. Joseph's Medical Center, serves as adjunct faculty at the University of the Pacific Doctoral Physical Therapy Program, and has telehealth consultation practice for lymphedema and lipedema. Now, you make me seem like I haven't done anything with my life. So I really appreciate you being here, and I hope that everybody learns a lot from Karen. Now I'm going to be quiet because I'm sure you'd much rather hear from her. But thank you so much for being here, Karen. Thank you, Phyllis, for setting all of this up. So, Karen, without further ado, please take it away.
Great. Well, thank you so much, Joshua. And thank you, Phyllis, for working together and inviting me to present today. This is such an exciting topic for me. And I love that we're being playful today and talking about this in terms of waffle weave, waffles for breakfast. So I want you to start your day right with antifibrotic compression. Let's start, though, with lymphedema. And we all know that it's excess interstitial fluid that creates swelling. And at the 3 month mark and beyond, it becomes chronic. And at that point, it is called lymphedema. But not a lot of people are aware that lymphedema promotes fibrosis formation. Let's talk about fibrosis. When we stage lymphedema, a lot of us think in terms of swelling. How much swelling is there? Is there apparent swelling? Is it pitting? Is it severe? But what's really going on is way more than swelling. So when we look at the actual categories of each of the stages of lymphedema, starting with the latency stage, where there is no visible or palpable swelling, there are focal fibrosclerotic tissue changes already happening. So even before we can detect it, we're getting fibrosis starting to form. And you can follow that gold lettering all the way through the stages. It continues to increase until at stage 3, it's extensive, as well as stage 2. Now, I want to turn your attention to the red lettering because that signifies the adipose deposits, which are not present in stage 0 or 1, but by stage 2 and 3, they are prevalent. And then by stage 3, we're also seeing in green the skin changes, which are not positive. So let's talk a little bit about how fibrosis forms. I want to say that fibrosis makes lymphedema irreversible and that all patients have at least one form of fibrosis. So when we see the stages of lymphedema in pictures, you can see how the arm is getting bigger and bigger and bigger. And in stage 0 and 1, that is swelling. That's mainly lymphostasis. By the time we get to stage 2 and stage 3, we cannot fully reduce that arm because the fibrosis has built up. So we can decongest the swelling, but the fibrosis is not decongestible and it's going to remain, and the arm is going to be bigger than the other arm. When we look at breast cancer related lymphedema, we see a lot of different types of fibrosis that are commonly found. And this patient is displaying 3 of them. So lymphostatic fibrosis, which we're going to hear more about, which is prevalent in every lymphedema patient, as well as surgical scarring. You can see clearly her surgical scar, as well as the hyperpigmentation of the radiation-induced fibrosis. Those top 3 are typically the most common forms of fibrosis in breast cancer-related lymphedema, but we can see other types of fibrosis too. And if you want to learn more about these, there are lectures that I've done that are available on the WARES website that go into more detail on this. Today, though, we're going to focus more on the solutions. Lymphostatic fibrosis, as I've been mentioning, I promised I would tell you what it is and how it is created. So we have lymphostasis, and in that condition where we have the stagnant lymph fluid that is not necessarily decongested well, over time, and we're not talking days, we're talking months, a process known as adipogenesis occurs, which is where the fluid attracts fat cells, and these fat cells knit together with the fluid and form abnormal tissue. So as you look at my patient here, you can see clearly her right arm is bigger than her left arm, and that when we do reduction with her, that it's still bigger because of that extra fatty layer of lymphostatic fibrosis that gets worse and worse as lymphedema progresses. So it's very important to really address that fibrosis and work on arresting it, because the more fibrosis, the worse the swelling. Fibrosis is progressive, just like lymphedema, and it makes the tissues harder, denser, and stiffer. It blocks and interferes the normal lymphatic flow, and as you could see from my patient, it can be very disfiguring. It also interferes with function, and it makes lymphedema worse in this vicious cycle where you get increased fibrosis, that aggravates the swelling, which goes back and aggravates the fibrosis, and so on and so forth. It just gets worse and worse. So we want to stop that. I want to just thank my colleague, Dr. Håkan Brorson from Sweden, for allowing me to use his slide here. This is looking at before and after liposuction surgery of this woman's left arm. And what he has found is that when he extracts the exudate in the liposuction surgery, it is over 90% fat. So there's also some fluid and there's a lot of collagen. I had the honor and ability to watch a lymphedema liposuction surgery at the Cleveland Clinic with Dr. Wei Chen. And man, he was sweating bullets trying to extract that because it is very hard and gluey and very difficult. It's not like normal body fat that is fluffy. This is a much harder fat that it is uncomfortable for people to have. When we treat lymphedema, we want to address fibrosis and we want to go to the source of the obstruction of lymph flow. So we want to look at the areas of damage. We want to look at the scar tissue, at the irradiated tissue, at other hardened areas that are backing up the lymph flow, that are creating dermal backflow and aggravating the lymphatic congestion. So in our treatment, we really need to eliminate that barricade. And there are so many different ways that we can do this. If you want to know more, I teach all kinds of classes in this, and I wish we could go over these today, but just know that there are many specialized manual therapy techniques beyond MLD, as well as positive and negative pressure modalities. Light therapy is fantastic for treating fibrosis, as is vibration. I have been doing a current research on ultrasound cavitation and extracorporeal shockwave therapy as a conservative treatment for fibrosis, which looks promising. Thermal modalities can also be used in cautious ways, as can dry needling, of course, silicone scar gel, and pneumatic compression. So these are just a few of the tools and techniques that are out there that are available that you may want to check into for your toolbox if you're not familiar with all of these. The focus for today, however, is going to be on antifibrotic compression garments, which provide both texture and compression. I was speaking at an NLN conference on Saturday and talking about compression and saying that if we're going to be giving patients compression anyway, if we make it an antifibrotic compression, they're getting both treatments. So why not? There's two types of antifibrotic garments. On the left, you can see textured fabric in a waffle weave, and on the right is a quilted foam pad. So when we pair these with external compression, this gives the tissues an amazing micro massage. So the fabric by itself is very low profile, and then with the pad, it's higher profile, and they both have their advantages and drawbacks. The short-term effects of this treatment are to stimulate circulation and promote decongestion. So this actually helps to eradicate lymphedema. On the long term, this softens the tissues that are hard and it prevents fluid buildup. And a lot of my patients have said that they feel like they receive a massage every minute that they're wearing these garments because it is stimulating the circulation and fighting that fibrosis. So to really get the maximum benefit, patients could wear these day and night. I love it when patients wear them during exercise because that creates additional compression and stimulation. And then wearing them during pneumatic compression treatment is another way of getting even more benefit from these garments. So let's talk about what they are and what they do. This is the Andrea t-shirt, which is a compression garment that has sewn in anti-fibrotic axilla pads. So this is something that women can wear with or without a bra. It does not have prosthetic pockets, and you can choose to have axilla pads on one or both or neither sides. But Waries took this a step further, and they made a compression t-shirt with removable pads. So you don't have to necessarily always wear the pads. And why would you want to take them out? Well, to make a lower profile garment so that you don't have the bulk of the pads. And this might be for a special social situation, for instance, where you still want that excellent compression, but just want to be able to not have the obtrusiveness of an axilla pad there. This can be worn with or without a bra, and it does not have a pocket for prosthetics. Another great option is to use the L&R swell spots with Waries bras and camisoles. So the bras and camisoles are providing this external compression, and Waries and L&R pair very well together to make this wonderful anti-fibrotic compressive effect. So here you see this, the curved pad, the breast pad, and the circular pad all working well with the Waries garments. And a few more examples. We've got a kidney pad, a lateral pad, and a full bra pad. So these are great for taking in and out for washing, and again, being able to make them removable for social situations where you may not want to have the bulk. That is a great option. I love the sternum and genital pad. This is one of the most versatile pads. And here you see that it is separating the breasts, and it's filling in that gap to provide better compressiveness with the bra in that area right over the sternum. A lot of women wanted to have a lower profile anti-fibrotic treatment. And Phyllis Keith sourced this waffle weave fabric and created this amazing bra based on a prototype that I presented at a conference many years ago. I took a post-surgical bra, I cannibalized a garment that had waffle weave, I sewed it in, my patient loved it, so I put it on a slide, and Phyllis saw this and she said, wow, you got something here. We need to look into this. So she sourced the fabric, she created a prototype, she tracked me down at a conference, and the rest is history. We have run this through many focus groups. We've had a lot of patient feedback. We've made a lot of modification to this. And the end result is that we have a very comfortable, low profile bra that covers a wide area, even the straps. And this provides really good compression without binding. And it's also very easy to put on and take off. So this garment has taken the lymphedema world by storm. I was telling Joshua earlier that I visit a lot of clinics, I go to a lot of conferences, and I see a lot of lymphedema therapists. And as soon as they find out about that I helped to develop this bra with Phyllis, they get so excited and they talk about how their patients absolutely love this bra. It is a game changer, that there's nothing like this anywhere. So I want to talk a little bit more about some of the focus group results so you can kind of see why we're so excited. So this is an actual patient from our focus group wearing the bra. And some of the feedback that we got is that women really love how this stimulates the scars at the breasts, axilla, and thorax. And as a result, this provides a lot of relief from pain and swelling, as well as promoting comfort and healing. You can see the little waffle effects on her skin as she takes it off, and that's how we know it's working. So the net result is decreased pain, decreased swelling, decreased tissue hardness, improved skin texture, improved scar appearance, and improved skin appearance. All of these, the women raved about these results. And these are just a few before and after pictures and comments from patients saying that having the tool of anti-fibrosis along with compression is the perfect mix. It is amazing. I have had fibrosis that has worsened the last 3 years on the left breast, and after a short time of wearing, symptoms are reducing. As if this wasn't good enough, wait, there's more. Hot off the griddle, we received a lot of requests. Once they got a hold of the Carina bra, everyone said, oh my gosh, this is great. And wouldn't it be wonderful if we had a bra that would look good under clothing, that was more of a conventional bra? And then we also got a lot of requests for bike shorts. So these two new garments are just now being launched. You are one of the first to hear about these. And hopefully you'll be one of the first to order these for your patients and make them really happy. So let's talk about them. This is the best bra, and it provides texture plus gradient compression, and it is very flattering under clothing. It's breathable and comfortable, and it has a double construction that provides sternal compression. It provides relief from pain, swelling, inflammation, and overall discomfort. And the focus groups that we used with this garment said that it was even comfortable enough for night use, which is great. The textured lining softens radiation fibrosis and both old and new scars in the breast, thorax, and axilla. And then also the best shorts, which provide texture and gradient compression in a breathable fabric in the groin area, which is very comfortable. The double construction prevents riding up. And I can tell you, I have worn this myself and compared it to another anti-fibrotic short that has no double construction. And this is night and day difference. This is a very well-made garment. And this textured lining softens the tissues at the waist, hips, buttocks, and thighs, and provides relief from pain, swelling, inflammation, and overall discomfort. So what's so wonderful is that
So
Waries has
I'm
been
let me
around a
interrupt you
long
real
time.
quick. I'm
Yes.
uh,
Yeah.
sorry, Karen. I wanted to interrupt you because there was a couple questions. I wanted you to get through all of the products because I think the question that
We
Sarah's
are.
asking was
I'm at the last
asking kind of
slide.
about all of them across the board. Yeah.
Sure.
Yes. Oh, you're at the last slide. So,
Yeah.
so like, I'll let you finish then, and then I'll cover the questions then. I'm sorry to interrupt
Well,
you. I was like, well,
that's
all of
okay,
those slides
Joshua.
just happen to be particular to this question, so I was letting you finish those, but
Oh,
finish up, and then I'll go
well,
through the
and we can
questions.
go
And I'm
back,
sorry I didn't mean
and
to
I think
interrupt
people
you
have
for the
read this
last
slide. And
slide. So
the main thing I wanted to
yeah,
say
you're good.
about this is that Waries has been around a long time and has a great reputation. And this is making Waries, it's it's opening up a whole new direction and a whole new avenue of providing care in for women that have and men that have fibrosis. So I'm going to end the conversation here, and I would love to take questions. And Phyllis Keith, who is the founder and president of Waries, is also here. So anything I can't answer, she can handle for sure.
Absolutely. So I'll kind of field it for you. Keep you guys from having to manage the chat too, and just focus on answering some of the questions. The first one, though, I might be able to handle this. Sarah asked, "Are these products covered by insurance?" And well, the answer is yes. We definitely do that. We do it all day long. And I mean, I've been lucky enough to work with Phyllis and Karen in the past. I know you've done another presentation for us, and I really do appreciate this and that one. But yes, we can absolutely get your patients in these garments and get them covered by insurance. Another question: are the shorts sized for men as well as women?
And Phyllis is nodding yes.
Yes, yeah, they would be good for men. We're still working on the sizing, so we'll continue to update the sizes on our website. But we started out with medium, and it goes all the way up to a 2X, 5 sizes. And I think they run large, and that's why we said the sizes are up to measurements. So you'll just have to try them and let me know. But they should work well for men. We and we've and also we've tried the Karina on men. If you take the bust cups out, it becomes a flat vest, and it works well for bilateral women or men. We just haven't packaged it as a Carl, but it and the shorts will work for men too. Yes.
Okay, well, you got a Carl, you don't have a Joshua, right? That's something we need to work on next.
Phase two.
So okay, so is there phase two, the Joshua? Yeah, it's gonna be lopsided. A little weird. Yeah. Is there? Wendy asks, is there a plan to make the bras adjustable for those who need it? And I know this is a question right up Phyllis's alley because she does like to create things. So
The best bra is adjustable. So if you look back at Karen's slides, or if you look at it on our website, um, it has conventional lingerie straps, and you can adjust it. You can also undo the straps and crisscross the back. See that on the slide? So it's very adjustable, and it has the
okay,
adjustable back like a conventional bra.
And the Karina
awesome,
bra is
awesome.
also adjustable.
D-
You can adjust the straps on the Karina
Mm-hmm.
bra as
Mm-hmm.
well.
okay, awesome. Um, Marianne asks, does the best bra have a pocket for prosthesis?
Yes. Yes, the Karina and the Best
Awesome,
both have
wonderful. That's great.
prosthesis.
And then Yvonne is asking, how many compression bras do different insurance companies pay for? That honestly it's a little bit of a loaded question, but because a lot of it depends on diagnosis, I have seen three is kind of the standard, right? Everybody says, "Oh, daytime garments, you can get three for whatever," but the truth is that we've done six, we've done eight. It really depends, and so um, your the best way to answer that question is to say absolutely yes, they will provide these bras. And then what we'll do is when you send the patients to us, we'll actually find out for you how many bras they can get. And it is variable, but I would say that you could look at three as you could look at a three as a very safe minimum number. and then it will go up from there. And some of the insurances, they won't allow us to bill them all at the same time. So we do 4 now and then 4 3 weeks from now. That's fine. But I don't ever want to overdo it. But if the patient needs it, then the patient needs it. And so the way I look at that is, I don't have the same undershirt every day for multiple days, right? So the base minimum for me would be 5 to 7, right? And so, but you can usually get to that number with some of these insurance companies. So just you send the patient over to us, we'll find. I know that makes it a little more difficult for writing prescriptions and things like that. The best way to look at that though is start with 3, and we'll move upward from there because that's usually a safe bet. Um, is the Carina billed as a daytime or a nighttime? So, uh, oh, yeah, Claudia is answering for me. I will let Claudia, since you're in this chat, I will let Claudia answer that as she is more the specialist than I am. I believe that she's about to say daytime on here, but I just want to make sure that I don't mess anything up and say the wrong thing there. But I guarantee she's about to say that it is a daytime bra on the Carina.
I should
While we're
mention,
waiting on that answer, let me move here. I'm sorry.
oh, just a quick comment. I'm here in Florida right now, and we had an NLN symposium on breast cancer on Saturday at Orlando Health. And one of the participants came up to me and said that their surgeons are ordering the Carina bra immediately post-surgery, and that the women are wearing them even with their dressings because it is such an effective post-surgical compression bra. And then after the wounds heal and their dressings are off, then it really helps to influence the scar formation in a very positive way.
Nice. Okay. Um, Ashley's asking a question, and I'm having trouble reading it. Honestly, it's weird how it's almost cut it off. At least I think it's Ashley. It's almost like it's merged 2 chat features, and I just want to make sure I'm not getting anything wrong. But it says for the, I don't know, it looks like //5. How does that size fit? Um, and I can't get rid of the laughter mark that's covering the last word. I don't know how to make this. Let me see if I can just. That's all I got there. That's all I get there. There's some kind of comment that's kind of hidden in there. I swear it's the weirdest thing. I've not seen this yet, but I don't know if y'all can jump over and see the chat there where Ashley has got something written laughing about the Carl, but I can't see what's underneath that in the chat. I can't real. It's like it's cut off halfway through it. I'm just kind of making
So
up what it says.
Joshua,
Yeah.
this is Phyllis's contact information. So Ashley, if we can't get that question answered, then please do reach out directly to Phyllis because I'm sure that she can answer it. And if she needs to pull me in, she will.
Okay. So, let's see. A lot of people are saying, like Judy mentions that our physical therapists ask their patients to be put in Carina bra a lot. Claudia did come back on that insurance question, so it depends on the insurance. So that's depends on the insurance. Did you say the Carina can act as a vest for a double mastectomy too?
Yes.
So
Yeah,
she's nodding
definitely.
yes. Yes, that's excellent.
Yeah.
Awesome.
And so, like I said, take the bust cups out, and it's a flat garment. And as Karen will tell you too, that if, say, they're not wearing prosthesis and they they're unilateral, they've had one breast removed, you can put a fiberfill form in that side, or you can put a washcloth or a knitted knocker. The idea is you want that texture to touch the skin. You want it to touch the chest. But yes, definitely it can be bilateral, flat.
Awesome. Thank you, Phyllis. I appreciate that. A couple people have said, is all this available to order right now?
Yes, everything's available. Um, this week we're doing a soft rollout of the best bra and shorts. You better hurry. We'll have more the 1st of March, but they're going fast. Yeah, everything's available.
Awesome. And then I've got a question. I have a patient who the size whose sizing does not fit extra small or small. Um, does that mean they have to order custom?
We don't have extra small. So, uh, is he bigger or smaller? You're saying
I
he's
was going to say,
smaller?
let's see if we get a little clarification in there. And what I might do is just connect you to so that you can ask that directly because I don't know is that and does that mean that the patient is measuring smaller, larger, or do they have a measurement that is smaller and a measurement that is larger? I don't know. So, but I will definitely make sure that I write down your name and
And
get.
normally we do not do custom. Um, but if we get a lot of requests for a custom garment, a particular garment, we'll just go ahead and develop it. So our goal is to be ready to wear for the majority.
Awesome. Awesome. And I've got a lot of people saying thank you. Claudia did answer also for me. We can bill it as a day or a night, but she's verifying it to make sure. I think the difference would be do you order pads with it at that point? So the bras, the Carina could be ordered as a daytime without pads, but if you order with pads, I think we could bill it as a nighttime. But Claudia's going to verify on that. And then what I will do, just to make sure that we get you 100% of the right answer, um,
So
Taylor,
Joshua, when you say
yes,
pads, are you saying compression pads like swell spots? What do you?
yes, yes.
So what we found is that because of the texture, yeah, they might need pads at night. I'm not an expert on that, but um, compared to other garments, that texture takes the place of those pads.
Okay. That's good to know. Thank you for that. I definitely appreciate that. Uh, Day or night. I'm gonna say then that you could do it, but most likely that would be daytime to make sure there. And then, well, Wendy's saying she wanted to clarify a little bit. Her question about the adjustability on the bra was actually meant for the Carina bra with regards to the girth, not the strap length. So,
No,
this is
it,
something my
yeah,
patients have
it's
requested in
not
the past.
adjustable. I know I've had people ask, can you put a strip down the front and put zippers on both sides? Like there's a competing bra like that. But we're not doing that. We feel like we lose the integrity of the style by doing that. So no, the only adjustability is in the straps and what you might put inside of it.
Okay, okay. We got a bunch of questions coming in. That's why I'm trying to field these pretty quick. This is fun. Um, uh, Okay, so Claudia says definitely if you order it with pads, it can be built as night, but the texture the texture might allow it to be built as a nighttime too. So we're going to verify and check that out. For just all intents right now, we can definitely bill it as a daytime garment, and that's what's going to get you more of the quantity. To go back to that other quantity question too, billing it as a daytime will get you a higher quantity level than billing it as a nighttime. Um, some patients have reported that the sometimes the band rolls up, but they love the bra. They're saying my patients love it, but every now and then the does she does hear that the band rolls up a little bit. I'm sure that I have actually heard that on our end. I've heard that with a lot of the bras because I mean we're dealing with swelling in patient skin, but maybe you can address that as well too on how that works.
Yeah, so we love to get feedback because, every time we go in to manufacture more, we have an opportunity to make improvements. Most recently, we added pink hook and eyes to the black bra so people who have visibility issues can better close the bra. They can see those pink hook and eyes. So every time we do a new manufacturing run, we have an opportunity to make a change. Um, with the fact that it rolls, you might look at adjusting the straps. We do have strap extenders. Like, say the woman is very long through the torso, you could get a pair of strap extenders and extend the straps a couple inches just, look at where it's hitting her and can you change it by adjusting those straps. But feel free to send me your feedback and we'll see what we can do. Right, Karen?
Phyllis is great at asking and receiving feedback. And just here's my comment about the rolling feature, and that is that as part of the focus group, we developed a thicker band to go under at the distal edge of the garment on the thorax. And the comments that we got were that it was much less likely to roll up because it was nice and thick. And so I know that that's an issue with lots of bras. And my experience with the Wearies bras is because of the integrity and the construction of their bottom bands that it happens much less with them.
Awesome. And Ashley actually wrote back talking about the where it rolls up. The pink hooks on the black is super helpful. So that's awesome. Uh, Mary's writing, she's trying to order the best bra on the Wearies.com, but she's not seeing the fitting guidelines. Can you advise on that? Is that on the website there, or do we need to provide that to her?
I'll have to go check. It should be on there. But what you want to do is measure. This is ideally you would measure a woman's normally we say nipple line with a bra on, so you get the widest measurement. And if she's going to wear prosthesis, then you want to include that in your measurement, and then go by that measurement to come up with the bra. So we put the bra in. It's the same as the Karina. It's in inches, and it's based on the fullest part of the chest with the prosthetics in place. And if you have any questions, you can call us about that too. But we try to make it as simple as possible.
Well, that's awesome. And, Mary, I also wrote down your name to Mary here on my list of things to do in the next couple days. I put you down here to make sure that we get you some of those fitting guidelines. If you can't find them on the website, we will make sure that you get them here in the next few days. Also, the lounge is still going on over at the Teams meeting lounge that we've been hanging out with all day. If you need to go over there and post any other questions or just talk to the team, ask them live what's going on, they're all there. I just dropped that back in the chat again, so you don't have to go back to the top. And then I'm going to drop back in the resources page because I want you to be able to go over to our resources page, get your certificates. I know you guys have, for those of you who've been with us all day, it's been a long day, and I think everybody has learned a ton. So, definitely go over there and get the certificates that you have earned. So, and then also click those download links because you'll be able to download all of the cheat sheets and fun stuff that Phyllis and Karen have provided to us here. And then we will be sending out all of this information in email format to you. We will be posting these videos. They will be on our YouTube channel. They will be on our website. We'll just have to have a little bit of time to get them uploaded, but we will get them uploaded and everybody will be there. You are also welcome to share these videos with your colleagues if you've got somebody. So, Labria, thank you so much. I really appreciate you saying that. She said, it's been a great day. Thanks. And I really appreciate, it's really the therapist showing up, taking the time to do this. I know you've got a lot of patients. I know you got busy schedules. Thank you so much for showing up to this. I know that the other class is actually starting here in just a minute. And on the billing class is starting here in just a few minutes. So I'm going to have to jump over to that one. But I definitely appreciate all of you for being here. Karen and Phyllis, thank you so much for participating in this training. Couldn't have done it without you guys being here. So I really appreciate you as well. So it's
Thank you,
been fun.
Joshua. Thanks for the opportunity to present. And thank you, Karen. I always love listening to Karen. And now I want to go eat a waffle.
I love it. I love it. Yeah. Thank you to everybody. I really do appreciate it. And yeah, I think it's about waffles for dinner time. That sounds like a good idea. So I love it. Thank you so much. Y'all have a great evening. We'll see you soon. All right. Bye-bye.